The lab experiment. As you can tell, I have been sick for a while, so my voice, at least in my own head, because my ears are freaking plugged to crap. I know my voice is messed up. But anyways, this recent event with United Health CEO. Now, at first, I didn't put too much thought into it, right? I'm thinking like, oh, maybe he was going to turn evidence on this recent lawsuit, even though he makes $10 million a year. You know, save his own ass, so somebody had him taken out. Then I started hearing all these stories from other people, which I can totally relate to. So, it's not just healthcare companies that are the problem. The entire healthcare industry is a huge fucking issue. Pharmaceutical companies, the hospitals themselves are all the issue. None of them, I repeat, none of them give a fuck about your health. The reason why they prescribe you a drug is to mask the symptoms. It is not to cure the disease. Why do you think grandma, who's 80 years old, has 12 fucking medications that she has to take by the time she's found dead because she slipped and fell in her retirement home? Me, personally, I worked at a hospital for 14 years. I topped out at $12 an hour. I was paying the same for health insurance as everyone else, the nurses, the doctors, the radiologists, you name it. We all paid the same, which meant I was losing 25% of my check to pay for insurance, which once you have what's left over, you can't afford to fucking use it. So yeah, never went to the doctor. This thing, whatever I'm dealing with now, I've had this for going on 4 weeks. Started as a sinus infection, throat infection, pneumonia, bronchitis. I don't know what the hell it is now, but it's just not going away. Last year, I worked 4 jobs. 4. Only one of those jobs provides health care for me, my wife, and my kids. But working 4 jobs, when the hell do I have the time to go to a doctor when I've got something like this? Granted, they get to go. The coverage is pretty good. We don't really ever see a bill. Occasionally it's like $10 here, $20 there. But still, the notion that this guy, I'm not surprised. This guy made $10 million a year running that company. Now, the hospital I worked at, it started out, they had a non-profit status, right? Which sounds pretty good. Then later on, they changed it to a not-for-profit status. Don't really know what the difference is, but they really pushed that one. Now, the head of the hospital, he made $3.3 million a year. And at the time, that was more than the head CEO of GM, the head CEO of Ford. Granted, and keep in mind, this is a hospital in Michigan. So when you have the big 3 automakers and their CEOs are making less than some fucking CEO of a hospital in Kalamazoo, right? There's something wrong here. Now, they're trying to say like, oh, well, we hire the best of the best of the best. Okay, so why is it the fucking janitors in Grand Rapids are getting paid $7, $8 more an hour to do the exact same job when you're constantly competing with those hospitals? But then when you want to hire a CEO, He's making more than the head of GM? Are you fucking kidding me? Not to mention this guy, fat fuck, is not exactly the stereotypical image you get of health, okay? This guy making $3.3 million a year ends up in the hospital as a patient. And for years, they pushed this no falls policy. If you fit into this chart, you got to have this bed monitor. You got to have somebody sitting with you. Make sure you don't fall and hurt yourself. No, of course, he made it so that that shit didn't apply to him. And guess what happened? Motherfucker fell out of his bed because the policies don't apply to him. Yeah. So anyways, did I also mention the hospital when I worked there was constantly short-staffed? Every fucking unit was short-staffed. Nurses, PCAs, you name it. Now, $3.3 million a year, he was equivalent to the average starting pay of 42 nurses. How many lives could 42 nurses save in a year compared to some fat fuck that doesn't know how to follow his own goddamn orders? And by the way, his primary residence was in Florida. He loved his job so much, he didn't even fucking live here. His primary residence was Florida. Now, what kind of dedication is that? Yeah, I'm going to run this place for 10, 15 years. Nah, I don't need to live anywhere near, well, what could possibly happen when you're the head of the hospital where I'd have to be called in? It's not like he's saving lives or anything. Just making over $3 million a year. So that was the previous guy. Then there was the next guy that replaced his ass. And 2020 happened. So they had a little problem with some jabbity jab stuff. So what'd they do? They started offering money. If you got the jabbity jab and you kept up with the jabbity jab, you got a bonus check with every time that you got it. I don't remember that with the fucking flu vaccine, okay? I don't remember that at all. But for some reason, they had to entice their employees to the point where they're like, hey, here's a free check if you just get this thing. And we don't know what the fuck it is or what it does, but we want you to get it. Because heaven forbid, you know, their partner in bed, yeah, that's right, Pfizer, right down the street. It's amazing. Whatever Pfizer wants, Pfizer gets at that place. Then there's the medical school, which is also in bed with Pfizer, and the hospital. Yeah. So you think that there's not something going on with the insurance companies as well? Of course. No, the corruption is rampant everywhere. Everywhere. I'm telling you. It's gross. It's sick. The amount of shit that I saw working there during that time, the amount of stuff. I knew a guy who worked in the ER with me. Now, we both had the same insurance. He was out on the weekend, out of work. Something happened, broke his arm. Now, this is a guy who helped take in patients into the ER, right? There's the triage center, right? So this is somebody who knows what an emergency is. He breaks his arm, both bones. And his radius and his ulna. A couple hours later, he notices his arm is swelling. He's like, oh shit, this isn't fractured. Oh no, this is a break. So he knows he has to go in and get it reset. His dad, his dad is one of the oh shit, what do they call them? Bone doctors. Fuck. I can't remember what the hell they call them now. But you know, where they reset the bone, they do the x-ray, they do the cast. Anyways, that's his dad's job. So he goes in to the ER because it's after hours on the weekend. They do everything. They get it set, cast put on. He gets a bill, total bill from the hospital. And he's like, wait, what? Insurance should cover this. It's a freaking emergency. What the hell? So he calls the insurance company, and they tell him, well, you should have called your doctor first. It was after hours. You should have waited till the next day. Next day was Sunday. Well, you should have waited until Monday. It's a fucking broken bone. So yeah, that was his experience. It's funny now, and it's funny because it didn't happen to me, but this happened to a lot of people at the hospital. So the insurance that the hospital is providing their employees would turn down a shit ton of the claims, right? Including broken bones. So what happens? Well, when you're on a pay scale like me and this guy, you don't have the $1,500 out of pocket to pay to the hospital. And the hospital's policy is if you don't pay the balance, the entire balance within 3 months, they take your ass to court. If you are an employee, they immediately take you to court because they know your source of income and will fucking garnish your checks. I'm not making this up. So yeah, what happens? They take him to court. He fights with the hospital saying, hey, this is the insurance you provide. And they're like, yeah, we provided you with insurance. You're going to have to work through them. He's like, your insurance sucks. And they're like, nope, you got to work through them. It's provided to you. So he goes to them and they're like, we stand behind our findings. This was not an emergency. So the hospital goes through with taking him to court and garnish his check until everything was paid. That is how they thank you for your service. When you are working double shifts because you're fucking short-staffed. When they ask you to work an extra day because, oops, scheduling, somebody's on vacation or some other bullshit. Somebody didn't come in, can you work a double? This is how they repay you. This is why I don't work in that industry anymore. It is thankless. They don't give a shit about you. They are just another corporation like every other company. You are a number. And no, the building didn't burn down after I left. They just replaced my ass. Just like they replaced everybody else I saw who either died while they were working there and nobody gave a fuck, or they retired, died a couple weeks later, and nobody remembered who the fuck they were. Welcome to America.